Good morning. Good morning. Good morning. Thanks. I'm Jim Traficant, Vice President and General Manager of Harris Healthcare Solutions. And it's a great privilege for me to be here with you this morning. And I mean that literally, and you'll understand that shortly. And thank you, Tim. Healthcare represents our greatest economic vulnerability, or the source of it, as a country. It also jeopardizes the fiscal as well as physical well-being of our people. But the challenges that are inherent are also representing the greatest opportunity for us to restore the moral and economic strength of our nation. And we have a once-in-a-generation opportunity to deliver on the promise of healthcare transformation. We have to do it right, and we have to do it right now. It was July 19th. I was standing at the Dome at Johns Hopkins with my great friend and neighbor, Frank Finelli. Frank is a retired Army Lieutenant Colonel, a Ranger. But this particular day, one of our nation's heroes was confronting his own mortality, not in a battlefield, but in an operating room. I escorted Frank upstairs. We waited in a pre-op surgical unit. The nurses came in and out. They were bringing him medications, checking his IVs, checking his vital signs. And then about 7 a.m., a nurse walked in and said, "It's time." Frank stood up as if on cue. We awkwardly embraced, and then with tears in his eyes, I saw Frank Finelli kiss his wife goodbye and be wheeled away to an operating room where he would risk his life for mine. I'll never get over it. I don't want to get over it. I hope by the time we're through, you can't get over it either. Frank and I were the fifth to have a living donor liver transplant surgery at Johns Hopkins. We were the first that weren't related. I've been to the brink of death 3 times, now with 2 liver transplants and an episode of sepsis in between. As a result of all I've experienced, I've committed to do everything in my power to help participate in making a difference in healthcare. And I refuse to squander the gift given me. And I would encourage us to refuse to squander the opportunity given us. Exceptionally dedicated and skilled medical experts saved my life. There's no lack of will or passion inside of healthcare. But unlike every other industry I've participated in, there's a lack of a data-driven construct for situational awareness at the point of decision-making. The great lesson learned in my travails through our healthcare system is that they have all the data you could ever hope for. What they lack is all the information you might need to save your life. When my transplants, I had great doctors, and they pledged they would do all they could to save my life. Their caution was that the surgery was science. The medication was an art. The challenge was suppressing my immune system sufficiently so I would accept the transplant, but not so much that I would succumb to infection. They said, look, if you go into rejection, if you get infection, either one, we'll treat it. After the surgery, I had a very quick recovery. I was ready to go home in 6 days. Frank was struggling. And while I was waiting for him to get well, I went into rejection. And they couldn't stop it. And the doctor said, we're going to give you a shot. We don't know if it'll cure you or kill you. We'll know in 20 minutes. Now, I'm a technologist and a business executive, and I said, what is plan B? And that wasn't one. This was it. I was in the hospital for a month, quarantined in the most expensive part of the hospital, life-threatening treatments. Finally, I got to go home. Within a couple of weeks, the rejection reoccurred. I was rushed back to the hospital, this time under an experimental treatment. I was the first person to take the medication. I again was in the hospital for a month. Risky treatment, expensive treatment. When I got out this time, though, I started to study my blood work and my medications. And I came up with an algorithm that you could predict when rejection would occur. I developed the symptoms a 3rd time, showed the data to my doctors. We changed the medications, and it worked. Instead of having to be hospitalized, the rejection was abated, and we were able to avoid the cost and the hospitalization. The answer was in the data. It was true then, and it's true today. We need to recast some of the stone edifices inside of our major medical academic centers and great hospitals around the country where they say medical arts on the top, and instead drive them towards transformation driven by information sciences. And electronic health records are key to making that transformation possible. We've got to go from art to science, from data to information, to get the right information to the right person on the right device at the point of care and benefits delivery. And electronic health records are key to making that transformation possible. Digitizing health records and information within care and benefits workflows can only happen as we drive electronic health record adoption in this construct of meaningful use. And meaningful use, in my terms, that's saving lives. And we've got the policy out to get this started with a carrot rewarding incentives for electronic health record adoption through 2015 and meaningful use of the data, and penalties that follow thereafter. And I credit the policymakers for driving the transformation. Extending the promise of health care to all of our citizens was a noble and bold initiative on the part of our president. We're one of the last industrialized nations to make health care available to all of our people. It's a terrific first step. But more has to be done to achieve the vision of transformation, and there are two key factors that we must get at. The first is we have to lower the cost, and the second, we have to improve the quality. The challenge is these can't be done sequentially. They have to be done now. The additional pressure introduced by adding tens of millions of patients into an already overstressed system is untenable. Something has to change. But the answer is in the data. And the good news is we know how to get at it. OMB has cited that we could take out 1/3 of the federal spend if we can get to a data-driven care delivery model. Electronic health records will help accelerate the inflection point in transforming a paper-based, fragmented, disintegrated industry into a digitized, interoperable one with a connected framework. And digitizing health records is essential, but it's not enough. At the end of the $30+ billion federal spend, if we only have digitized health care, it'll be better than what we have, but a far cry from what we need. What we need is an interoperable health system. And the Office of the National Coordinator, with advocacy from the White House, is doing a terrific job of driving this policy change. And they're using an interoperability strategy leveraging the proliferation of electronic health records. And the nationwide health information network is key to that strategy. Now, this network is not a physical network per se, but it's a trust framework for information to be shared with security and privacy and patients in charge of how their information is shared. It allows us to leverage the internet for secure, on-demand health information exchange. And Harris is supporting the ONC and the federal health architecture with NHIN Connect for enterprise-level interoperability. And also with NHIN Direct for a more simplified interoperability at the physician level. First, let me tell you about Connect. Connect is a suite of open source, it's free, enterprise-level services connecting federal agencies whose primary mission depends upon access to electronic health information. The greatest consumers of health data, like military health, the VA, Indian Health Services, can now share and collaborate with the consumers like CDC, the National Cancer Institute, Social Security, and others. And we know that over half of all care delivered to our active duty and retired service members comes out of the private sector. So it's not good enough that we could just get the federal partners to collaborate. We've got to reach out to the private sector as well, and we've done so. We've connected with some of the large enterprises like Kaiser Permanente with a pilot in San Diego, the regional health information exchanges like in Tennessee with Med Virginia and others. And there's been a broad adoption of this open source framework embedded in a number of health IT products that are available as commercial off the shelf. The effort is great, the intent is good, but the proof is in the results. Social Security testified it used to take on average 83 days just to find the health records to determine what you should get in the way of benefits. For our wounded warriors coming back from Iraq and Afghanistan, this is not acceptable. And now we've gone from, when they go through Connect, they testified, we went from 83 days to 24 seconds getting that information. That's transformation. Dr. Blumenthal and Anish Chopra and other leaders in the federal sector are collaborating to drive interoperability, not only at the enterprise level, but also with physicians. And they're simplifying this to create an ecosystem for businesses to innovate and for health information to be shared broadly across the whole spectrum of care. Transformation was in reach thanks to electronic health records, and interoperability is the key to delivering on the promise. I look forward to collaborating with many of you over time to deliver on the promise of healthcare transformation for our nation. It's our chance, and now's our time. Our parents, our children, and future generations of Americans are counting our success. It's time to deliver healthcare transformation, turn healthcare from art to science. The answer's in the data. Let's get to work.